Good afternoon, everybody. Thank you for joining us. As usual, I will start with the statistics for today and report that the total number of positive cases yesterday was 1,707. That represents 8.3% of the total number of tests, and the total number of confirmed cases is now 157,079. 526 of the new cases were in Greater Glasgow and Clyde, 242 in Lanarkshire, 205 in Grampian and 177 in Lothian. The remaining cases are across 8 other health board areas. I can also confirm that as of yesterday, 208,207 people had received their first dose of vaccine. 1,829 people, unfortunately, are currently in hospital. That is 35 more than yesterday. And as you can see from that figure, the hospital occupancy as a result of COVID is now significantly above the peak that it reached of around 1,500 patients in April during the first wave. 142 people are in intensive care. That's an increase of 8 from yesterday. And while that figure remains below the peak back in April, the number in intensive care at any one time from COVID peaked at around 200. So 142 is below that, but nevertheless that figure is rising. And both of those figures for hospital admissions and also for people in intensive care demonstrate and illustrate the pressure currently being experienced by the NHS, and of course remind us how important it is that we all play our part in ensuring, as far as we can, that that pressure on the NHS does not increase. I'm also very sorry to say that 64 additional deaths have been registered in the past 24 hours of patients who first tested positive over the past 28 days, and the total number of deaths under this measurement is now 5,166. And yet again, we are reminded that these are not just statistics, that behind every one of them is a real human being, somebody who was loved and is currently being mourned. So my thoughts and condolences go to every family around the country who is in that position. Now, the Scottish Government will also publish later today, as we always do on a Thursday, the latest estimate for the R number. That will show that the R number remains above 1, perhaps as high as 1.4 right now. But it's important to stress that that estimate will not yet take full account of the new restrictions that have been in force for the past couple of weeks. Now, I'm joined today by Dr. Nicola Steedman, Deputy Chief Medical Officer, and also by Dr. Alistair Cook. Dr. Cook is our Principal Medical Officer for Mental Health, and he's going to talk in a few moments about mental health and about the help that is there if you need it. That's an important message at all times, but it is especially important at this exceptionally tough time for everyone. There can be few people across the country right now that are not struggling in one way or another, and many people will be struggling quite a lot right now. So there is help out there if you need it, and Dr. Cook will talk about some of that shortly. Before then, there's a few things I want to highlight. I'll do it as briefly as I can. Firstly, I just want to give a brief recap of the additional restrictions that were announced yesterday. These measures will come into force on Saturday, and they cover, in the main, click and collect services, takeaways and the consumption of alcohol in public places, which will not be permitted after Saturday. We're also introducing statutory guidance on employers to make crystal clear the duty of employers to enable people right now to work from home whenever that is possible. Full details of all the changes that were announced yesterday can be found on the Scottish Government's website. But I would stress again how important it is for all of us right now to abide by both the letter and the spirit of these rules. Case numbers in Scotland, while we see early signs for optimism that they might be beginning to stabilise, are nevertheless far too high. The new variant is highly infectious, and all of us need to do everything we can to reduce transmission while the vaccination programme picks up pace and does its work. So I'm asking everybody not to think in terms of the maximum that you can do within the rules. The question we should all be asking ourselves right now, every single day, when we are thinking about going out of our house to do something, is not, can I do this? Do the rules allow me to do this? The question we should be asking is, should I do it? Is it really, really essential for me to do it? And what we're asking everybody to do is to try to limit our interactions as much as we possibly can, because that is how we deprive COVID of every possible opportunity it has to spread. I know this is really tough. There will be nobody in the country not finding these restrictions very difficult right now. And of course, that's why Dr. Cook in a few moments will talk about mental health, and why the other issues I want to briefly cover today also highlight support that is available to anyone who needs it. Firstly, let me remind you that the National Assistance Helpline, which was set up back in April, is still open and it is still taking calls. I'm going to read out the number for that in a moment. I'll do it a couple of times so you can quickly get a pen if you need to. But the helpline is open from Monday to Friday from 9 a.m. to 5 p.m. and it's there to support people who might not be able to call easily on friends, neighbours or relatives for help, and people who don't have access to digital technology or who might not feel very comfortable using that. If you phone the helpline, what happens is that you're put through to your local council, who will then help you get whatever assistance it is you need. Now, that might be food or medicine, it might be emotional support, it might be to have contact with volunteer groups. So if you think you need any help, then feel free to phone that number. And let me give you the number now. It's 0800 111 4000. That's 0800 111 4000. So if you need support and you don't have any other way of getting it, then that helpline is there for you. And the assistance helpline is relevant to the second issue I want to highlight, which is self-isolation. We know by now how important self-isolation is to ensure that people don't spread the virus, either when they have COVID themselves or have been in close contact with somebody who does and therefore is at risk of having it and passing it on. And self-isolation is essential to keep the virus under control, but it is really, really hard for anybody who is asked to self-isolate. One of the difficult things about it is that for it to be effective, everybody asked to self-isolate really has to stay at home immediately from the moment you are first told or the moment you first experience symptoms. That means you can't go to the shops one last time to get some supplies because, of course, if you do that while you're out there, you might infect other people. Many people, of course, who need to self-isolate can get essential groceries delivered to them by family and friends or neighbours and will have those networks to give them more general support. But if you are in the position of having to self-isolate and you don't have that support network, again, you can use the National Assistance Helpline. Again, it will connect you to your local authority and support you with whatever it is that you need. Other support is also available. If you're told by contact tracers to self-isolate, you will also be asked if you're willing to let your local authority have your contact details. If you agree to that, you may then receive a phone call from the Self-Isolation Assistance Service, and that will talk to you about any needs that you have. And finally, if you're on a low income and you're worried that you will lose money by self-isolating, you might be eligible for the Self-Isolation Support Grant. That is worth £500 for a 10-day period of self-isolation. You can apply for the grant through your local authority, but you can also find out more on the eligibility for it and how to apply on the Scottish Government website. And of course, it's also something you can discuss with the Self-Isolation Assistance Service. Fundamentally, self-isolation is a really important example of how during this pandemic, given the nature of what it is we're dealing with right now, we are all dependent on each other. And to get through it, we all have to look out for each other and help each other. And if we all self-isolate as soon as we're asked to do so, we are doing our bit to stop the virus spreading. So if you are asked to self-isolate, please make sure you do that, but also do not hesitate to ask for support if you need it. That basic principle that all of us have a part to play in controlling this pandemic is the point I want to conclude on. The decisions we make as individuals right now really do affect the health and well-being of everyone. We're all interdependent all of the time, but that has possibly never been more true than it is at the moment. So please continue to stick to the spirit as well as the letter of the current rules and guidance. The main message at the moment is a very simple one: stay at home. Don't leave home right now unless it is for a genuinely essential purpose. And think carefully about what is and isn't essential, not just in general terms, not just in what the law classes as an essential purpose, but what is really essential for you personally. Even though an activity might be classed legally as essential, we should all ask ourselves on every occasion before we go out if it is really essential for us and are we doing it as safely as possible. For example, instead of going for essential shopping twice a week, if that is your usual pattern, could you cut it down to just once a week? When you're out for daily exercise, could you take a route on your run or cycle or walk that avoids places where there might be others around? In everything we do, we really should assume right now that the virus is there with us, that we have it or somebody that we might be in contact with has it, because that is very possibly the case, and we should act in a way that avoids us getting it or spreading it. And of course, remember facts. Face coverings, avoid places that are busy, clean your hands and surfaces, 2 metres distancing, and self-isolate and get tested if you have symptoms. But fundamentally, the main message right now is the best way of protecting ourselves and others and the NHS is to stay home. Stay home, protect the NHS, save lives. That is what we're asking everyone to do. Thank you very much for listening to me today. I'm now going to hand over to Dr. Cook to talk a little bit more about mental health and the support that is available.
Thank you, First Minister. It's great to have the opportunity today to talk about the importance of mental health. I want to focus on one simple message. If you need help, it is out there. We know that the past year has been really difficult for many people, and re-entering lockdown will inevitably have affected people's mental health in lots of different ways. This time of year is recognised as one that can be very difficult at the best of times. Blue Monday isn't a clinical term, but it captures the sense that short days, poor weather, end of the festive season all come together, and with the current restrictions as well, it's no wonder if this feels like a struggle. It's important to hold on to the reality that this is temporary, and that even though we're in the middle of winter right now, things will get better. The vaccine shows us a light at the end of the tunnel, and we will get through this. We know just how resilient people can be. But in the meantime, the negative impact that many of us are feeling is real. The phrase we sometimes use, "it's okay not to feel okay," is as relevant now as it has ever been. Some of us might need a chat with friends. For others, making simple changes might help. Staying connected online, keeping up a daily routine, getting a good night's sleep, or staying physically active. To help with this, we've updated the Clear Your Head website with a winter refresh. Please take time to visit the site if you can, at clearyourhead.scot. It contains advice on how to stay well, but also links to help and support for your mental health. But sometimes the changes you can make yourself don't help with low anger, fear, stress, or many other reactions. It can be completely normal to feel like this when times are so uncertain. If that's the case for you, I want to mention some of the support that is available. NHS Inform at nhsinform.scot has a lot of expert advice for your emotional well-being, including if you feel down. There are other great helplines such as Breathing Space on 0800 838587 or the Samaritans on 116123. And please do not wait for something you think is minor to get worse. If you're worried or feeling overwhelmed and the information on Clear Your Head isn't working for you, you can talk to your GP or call NHS 24 on 111. That service is available 24 hours a day, 7 days a week. NHS 24 can offer immediate support or direct you to services that are available in your local area. And although we're in lockdown again, we recognise that specialist mental health support services are essential. They will continue to deliver most services through video and phone calls, but they can remain open for face-to-face sessions where needed, as long as they observe guidance relating to physical distancing and hygiene. Whatever help you need, one thing remains important: being able to say how you feel. Tell your friends and family if you're struggling, and be there for your own friends and family if they need you. But if that doesn't feel enough, please do not hesitate to ask for more advice and support. The right help is out there for anyone who needs it. We know that this is such a difficult time for so many people, for so many different reasons. It's never been more important to say if you're not okay. So please visit Clear Your Head clearyourhead.scot. And although recovery from this pandemic might not be as easy or as straightforward as any of us would have wanted, we will recover. Talking openly about our mental health and well-being and doing whatever works for each of us to improve it will help us in that recovery. Thank you for listening to me today.
Thank you, Alistair, and know that you're not alone in how you're feeling right now. Everybody across the country is feeling like they're struggling in some way. Even those of us who stand up here don't find this situation easy. So if you need help, make sure you get that help. We're going to go to questions now. Dr. Cook will be available to take any points around mental health. Dr. Steedman is also here, and as you know, will help on a range of clinical issues that come up in questioning. But the first question today comes from Gordon Cree from STV.
Thank you, First Minister. On the subject of vaccines, we remember back in November, the Health Secretary appeared to indicate to Parliament that it was the aspiration to vaccinate all adults by the spring. Now, I think it's fair to say that's not going to happen, but the vaccine rollout plan, which was published last night, although seems to have been subsequently deleted, doesn't appear to give any target date for when all adults it would hope to be vaccinated by. So is it still the aspiration to vaccinate all adults in Scotland? And when would you like to see that done by? And if I can ask Dr. Steedman, in terms of day-to-day use of the vaccine and avoiding wastage, what practical steps are being taken to do that? For example, because of people not turning up or doses left over from visiting care homes. I'm sure there's plenty of people who would happily travel anywhere at short notice to get them. So what is being done to avoid that?
Okay, we published the vaccine deployment plan yesterday, which had a lot of detail. It's been temporarily taken off the website. The UK government have raised concerns about the level of information we included in that on the projected supply of vaccine. We were seeking to be, and think it is important to be, very transparent around all aspects of this, to be clear on the targets we are setting for the numbers of people vaccinated, and then to give people as much assurance as we can, subject to all the caveats that we still have to put in place about the supply flows that we are expecting. But the UK government's got some commercial confidentiality concerns about that, so we're having a discussion with them about what can be published. But the information in that plan about the targets that we are setting, starting with the JCVI clinical priority list and then working on to the wider population stands as it was published yesterday. Yes, it is it's not our aspiration to vaccinate the whole adult population. It is our intention to vaccinate the whole adult population, and that is one of the things, not the only thing, but it's one of the things that makes this vaccination programme such a massive logistical challenge, because it's not like flu, where we every year do the clinically prioritised groups. This is a whole population, whole adult population, although as vaccines develop, we may be able to do younger people in future. The reason why we cannot give a definitive end date for the whole population is that we need to have greater certainty, not just on forecast supply, but on actual supply. But we want to do that as quickly as possible. So what we've done so far is give as much hard definition around the initial JCVI priority list, which, just to remember, is everybody over the age of 50 and people under 50 who have certain underlying health conditions, about 2.7 million people, so more than half of the whole population. We set out the milestones for that, starting right now with the care home residents, health and care workers, and the over 80s, and then working down that list. So we will, as we demonstrated, I think, yesterday, that we want to be and are determined to be really transparent about that and keep people updated as the information we have allows us to firm up the planning assumptions that we're making along the way. Nicola.
Thanks very much. So I'd agree, absolutely, First Minister. Our intention is to vaccinate all adults, because that's the advice that we have at present, and obviously we want to protect as many people as possible. Should it ever change in terms of the evidence, should it ever change that protecting those people who are most vulnerable is enough. If we find the vaccine has an enormous effect on transmission, these sorts of things can change how you vaccinate an entire population, but that isn't a decision that we would take. That's a decision that we would be given advice on from the JCVI, and it would be based upon scientific evidence. But until that appears, our intention is to vaccinate every single adult. In terms of your question about vaccination wastage, so we always have to factor in vaccination wastage as part of any vaccination programme, and that's essential for a number of different reasons. Accidents happen, but more importantly, it's for safety reasons. All vaccines, as we know, have to be kept at certain temperatures, certain conditions, and if there's any reason to think that that hasn't happened, for example, fridges and freezers can break down occasionally, then you have to factor in a certain amount of a wastage within a programme to ensure that you have safety within the programme, the vaccine is still working, and also that you have enough to do everyone that you're planning to do. So that's part and parcel, and the World Health Organization, in fact, has guidance on vaccination planning programmes, which includes the fact that you should factor in, at least in your planning purposes, some wastage. But it's key to differentiate that from what we want, which is to use as much of the available vaccine as we have and to absolutely minimise that wastage. And so there are a number of checks in place throughout the chain of the vaccine logistics until that vaccine gets to a person, including very strict monitoring on storage conditions for the vaccine. And clearly, because the vaccines we have at the moment are the multi-dose vials, then once you've opened a vial, you have to use it within a certain amount of time. And that adds an element of complexity to this programme, which we've spoken about before. But what we do also have across Scotland is really good cross-board collaboration. The boards have worked together so incredibly well on this, so that if people think that they are not going to use their full vials in a vaccination centre, they will often offer it to other boards who then get people to come to that place to get their vaccination. So we're very lucky in Scotland. There's an awful lot of that going on. And actually, you know, our wastage in the programme, our actual wastage is very, very small as a result. And just to add on, the other bonus that we have is that we now know in both of the vaccines, it is frequently possible to get an extra dose out of the vaccine vial, because there's always a bit extra in there to make sure that everyone can get full dose. And the MHRA have given us permission and authorisation to do that. So we are actually in many cases getting more doses out of a vial than we originally thought we would. So in fact, that counterbalances any wastage at all and is an added bonus that at the beginning of the programme we didn't think we would have. So hopefully that's reassuring for people that we are trying to use every drop of the vaccine that we possibly can.
Thanks. I think the planning assumption we used in the document was 5%, which is designed to take account of, you know, things going wrong, a big freezer failure. The actual experience so far is under 1%. So, you know, what we plan for is not what we hope will happen in reality. Katie Under from BBC.
Thanks, First Minister. I'm just wondering if you're worried about potential confusion for international travellers about when the requirement for a negative test comes in. Seems to be tomorrow for Scotland and Monday for England. And how concerned are you about the Brazilian strain, its potential arrival here and its impact on vaccine effectiveness? A clarification. I think the Health Secretary said in Parliament yesterday there was evidence of a minimum 90% vaccine effectiveness from 14 to 21 days after the first dose. I'm just wondering if that should have been 70% or if there's new data in the pipeline.
I'll hand over to Dr. Steedman on the questions about the Brazilian variant, if I can call it that, and vaccine effectiveness. Just very briefly for me on pre-departure checks, you'll recall I think earlier this week I said that would come into force in Scotland from 4 o'clock tomorrow morning, Friday morning. The UK government have decided to slightly delay that until I think 4 o'clock on Monday morning, which we will do too, because we need to see their regulations to ensure that ours align properly given the role of border force in this. So this is something that will now come into place in Scotland as well at 4 a.m. on Monday morning, not 4 a.m. Tomorrow morning. We're waiting to see the UK government final regulations so that we can make sure ours do what they are required to do. I'll hand over to Nicola on the other points.
Thank you. So as far as the variant of concern, which was first reported in Brazil, then I would say we are appropriately worried about that. The reason for that, just for those of you that might not know, is that this particular variant has been spreading really very, very fast and very widely in South America and now beyond that. And it's very like what you might have heard the previous South African variant. And the thing about these two variants is that they have two particular mutations, which means that they behave differently from the classic coronavirus that was in the first wave. The first of those mutations is one that is in our new UK variant, which is the 501, which is what we think increases the transmissibility of coronavirus. In other words, it makes it easier for people to catch coronavirus from someone who has it. So that clearly is a concern in itself. But what the Brazilian variant has that our UK variant doesn't have is another mutation, which is the 484, which is one that in scientific trials has been shown to be associated with a reduced level of susceptibility of that virus to antibodies. And so that's why people are worried about that, because they're worried that some of the antibody treatments that we use for COVID when people are very ill in hospital may not work against this new variant, and that potentially it could have some impact in terms of vaccine effectiveness because we target the vaccines towards that bit of the virus. So it's that really worrying combination of increased transmissibility plus potential less susceptibility to the treatments and the vaccine that people are worried about. So I think we're right to be worried about that. I don't want people to lie awake at night fretting that, as we see in the papers, that this is the super coronavirus or anything else. Studies are ongoing to look at the effect that this particular variant might have in terms of vaccine effectiveness. And you have to remember as well, the immune response is an enormously complex thing. It's got lots of different arms and lots of different cells and antibodies and things. It's not just one thing. And so we hope at the moment that the vaccines will continue to be effective against that variant. They may be slightly less effective, we don't know. Those studies are ongoing. And the other bit of hope that I would leave people with is that certainly with the RNA vaccines, we can adjust those, and companies are doing that work now. So we can put different bits and different strains of different bits of the virus into those vaccines. So we can change the vaccine as we do every year with the flu vaccine. So we are concerned, but we are doing everything that we need to do to be able to combat that, as well as everything else. But clearly, we don't want that variant coming in if we can possibly avoid it.
The kind of clinical explanation that Nicola's just given there gives me a lot of assurance, but there's also a layperson's assurance here for people, which Nicola alluded to there, which is around the flu. Every year the flu mutates. So if you get the flu vaccine, you don't get the same vaccine every year because it has to be modified to take account of the mutation. So right now, given what we're in, this talk of mutant strains of the virus is very, very scary. But that's what viruses do. And there's lots and lots of clever people working on making sure we understand that and that we can respond accordingly. Right now, I suppose the most important thing for all of us is to understand that it makes it more important that we abide by all of these restrictions. And in particular, perhaps, the travel restrictions. We're thinking about how and if we need to tighten those up. But one of the reasons not to be travelling in and out of the country right now is to avoid the risk of bringing any different strains into the country. So these are all things that, of course, we are concerned about, but there's lots of work ongoing to understand and respond to.
I was just going to come back because you also asked a question about vaccine effectiveness, which I wanted to answer as well. So what we do know about the vaccine effectiveness so far is that after a first dose, both vaccines are really highly effective. So certainly more than 70% effective in both cases after a first dose, and possibly higher than that. And after a second dose, the vaccines are, again, extremely effective, slightly slightly more effective than after the one dose, but we believe that what the second dose does really is prolong the immune response. So we have really, really effective vaccines. So that's the other thing. Even if we do get a slight decrease in vaccine effectiveness against a different strain, it may still be a really high protective level. So again, it's another reason to encourage everyone who's eligible to take up the vaccine. The levels are really, really high, and that's what people need to know.
Thank you. Peter McMahon from ITV Border.
Thank you very much, First Minister. First Minister, in the vaccine document, you say that over 80s living at home will be contacted by GP surgeries, and the majority of appointments will be at health centres. Now, a map that was in that document showed that for obvious reasons in a place like the south of Scotland, these centres are going to be scattered across the area. So in rural areas, there'll be older people who may not have access to a car. They may not be able to get the bus if there is a bus service. Could be a long way to the GP surgeries or health service or health centre. So what are you and the Scottish Government doing to ensure that people in those kind of areas like the south of Scotland, get the same access to the vaccination at the same time as their counterparts in areas like urban Scotland?
We've talked about this a couple of times earlier this week, I think. We will also, when necessary and in areas where it's appropriate, use mobile vaccination facilities. But there will also be the ability for the vaccine, and this is obviously easier with the AstraZeneca vaccine than with the Pfizer vaccine, to take it to people at home. Nicola may want to say a bit more about the practicalities of all of that. But the other point I would make is that this is clearly new in terms of being the COVID vaccination programme, but the over 80s are in the flu vaccination programme every year. So this is not new. This age group being vaccinated, having to go to GPs or alternative arrangements being made to vaccinate them if they can't do that, that is not a new thing. That is something that happens every year. So everybody who is eligible, and as we've been talking about earlier on, that is ultimately the whole adult population, but in these early groups, arrangements will be made in order to make sure that they get the vaccine in the timescales that we set out. I know somebody in my own sort of family network today in the over 80 group is going for her vaccination this afternoon. So the programme is up and running, it is working, and the vaccine will, people will be invited to get it, or the vaccine will get to them.
So we want to give people as much choice as we possibly can, and we do want to make it as easy as possible for people to get the vaccine, and that's not easy on a vaccination programme of this magnitude and this scale, as you can imagine. But the First Minister is right. The other thing about our flu vaccination programme is that our uptake in the over 75s every year is really, really high. So not only do we offer it every year, but the vast majority of those who are over 75 take it up and actually get the vaccine. So we have good history that this can certainly be done in this age group. And we're making it, I think, even more accessible as best we can with the logistic constraints with the COVID vaccine. So the First Minister mentioned that we are talking about mobile units to take the vaccine to people. We're also talking about just taking the vaccine into people's homes for those small group of people who really can't travel. But what we want as we move through this programme is to have a number of different ways for people to access the vaccine so that people can choose the way that best suits them, whether that's somewhere that's very close to them or whether it's bringing it to them. The other thing we're looking at later in the vaccination programme as well is using our primary care workforce, our wider primary care workforce, in a much more involved way. So our optometrists, our community pharmacists potentially, and our dentists. So we're really looking at absolutely every way we can make it as easy as possible to get the vaccine to people where they can access it in the way that suits them.
Okay, we will try to speed up a little bit. Jack Foster from Global.
Good afternoon, First Minister. Apologies in advance. I have two questions, but they're slightly different in terms of subject matter. The first, given the nature of the statistics that we're seeing right now, are there any plans to change the guidance on, or indeed stop the policy of extended households? And a slightly different sort of question. For the better part of a year now, you've stood up here and you've taken questions from journalists most days, and in what I'm sure most of my colleagues would agree has been a transparent and accessible format, much needed during a time of crisis like this one. But at what cost? I mean, whilst life right now, and indeed for the foreseeable future, is undoubtedly dominated by the pandemic, Scotland faces other issues of importance. Now, we can't ask about those issues in this forum unless they're directly or sometimes indirectly related to COVID, and that makes sense, of course. But are there any plans for you to hold any press conferences similar in format to these, where journalists are able to put direct questions to you about the many other issues facing the country and indeed your government? We know what those things are, but we can't discuss them here and we can't ask about them here. So is there any plan to utilise this format of press briefing for non-COVID business, even occasionally? And if not, why not?
I'll consider that. I don't think I could be accused by even my worst critic of shying away from standing in front of a camera and journalists and answering questions. Of course, I also do, most recently yesterday, the weekly session of First Minister's Questions, where opposition leaders can and at times do ask on a range of matters that are related to things other than COVID. So, and journalists ask us a multitude of questions every day, albeit not in the press conference format of things that are not to do with COVID. So, I'll consider that. But I think the country wants the First Minister and government to be really focused on leading through the COVID challenge right now. And there are many different aspects to that. So it impacts on the economy, it impacts on education, it impacts on the health service more broadly, it impacts on people's well-being. And so it's not a narrow focus. This pandemic is literally impacting on every part of our lives. And I think although it's a COVID briefing, I think we've seen in the range of topics that have been covered here over the course of the last 10 months or so, they have managed to go pretty widely into some of the wider impacts of COVID. But I'll always consider what more we can do. And the other thing, this maybe where people see me and advisors on a daily basis because we're in camera, but this briefing every day is a tiny, tiny part of our overall daily response to COVID. I and people are at this from first thing in the morning till late at night on a whole range of different things, and that just is reflective of the magnitude of things, the magnitude of the crisis that we're dealing with. There's no plans to change extended households. I'm going to ask Alistair maybe to say a word or two about the importance of people having some contact if they're living alone, but just to remind you, if you are living alone or if you live with somebody with children under if you live alone or live with children, then you can form an extended household with another household, as long as neither of you or the other household you're joining up with, do that with anybody else. And if any of you get sick with COVID, you all have to self-isolate. But it's an important part of trying to tackle the loneliness that has come from the restrictions that have been in place. Now, I can never say never about the things we might have to do if the situation with transmission gets worse than it is, but we have no plans at the moment to change that particular provision. But just in terms of things to help with loneliness being good for people's mental health, Alistair, you might want to say a word.
Sure. We recognise that loneliness and isolation can be a real significant issue for people who have mental health problems, or can impact on people's general mental health and well-being. So I think the ability to have an extended household for some people has been a real benefit through this period, and would be really keen to ensure that, if at all possible, that can be protected, because of the value, as I say, for some people that would do around loneliness and isolation. Again, the development of many of the digital platforms that we've seen in more common use over the last year has been great, again, for a lot of people to be able to maintain some of those social contacts and to reduce some of the loneliness and isolation. But we're also very aware that there are a lot of people who are in those situations who don't have access to those platforms. And I suppose the plea would be to those who are close to those to try and maintain contact as best they can with them through telephone or through other means if they're not using the digital platforms. But really keen to promote that people remain in as much contact as is safe with families and friends as they can through this period.
Thanks, Alistair. Alan Smith from Borough.
Thank you, First Minister. You spoke about the pressures on the NHS just now. Looking at the latest absence figures, they're showing on average just under 5,000 NHS staff being off every day due to COVID-related reasons. And I realise that's a small percentage of the overall workforce, but is up from just under 3,000 during the previous week. Both the BMA and RCN have expressed concerns, and with the RCN calling for staff shortages to be addressed urgently. How do you respond to those concerns? And a question for Dr. Cook, if I may. We've heard so often during this pandemic that people are essentially needing to hit crisis point before they can see someone about their mental health. That seems to be particularly the case for young people trying to access CAMHS. Are you satisfied that there are enough resources in place to deal with the level of mental health concerns that are in Scotland right now?
Hand over to Dr. Cook in a second. On staff absences, of course it is a concern, and it is one of the reasons to protect the frontline health workforce generally, but also to make sure that we are not seeing people go off sick through the next phase of this pandemic, that we've prioritised that workforce for vaccination in the first round of the vaccination programme. But we work with health boards to try to make sure that workforce issues are being properly addressed and that wards, intensive care units, you know, the parts of the health service that need it are properly and adequately staffed. We, at an earlier stage of the pandemic, brought other resources into the workforce, and you know, we have contingency plans should we need it that can be activated to do that again. But there's no doubt our health and care workforce right now is under the most intense pressure, and it's down to government with health boards to do what we can to support them there. But coming back to a recurring theme of mine, it's down to all of us right now to behave in a way that is not adding to that pressure, and that's really important. I'll hand over to Dr. Cook on the points about mental health.
Thank you, First Minister. I think it's important to emphasise that while there are services available, if someone reaches a crisis in their mental health and well-being, there are also supports which are available more widely. And the NHS 24 support and some of those other ones that I mentioned earlier are available to all the time. And there are also a number of services which are available through, for instance, primary care. There's been an increasing growth in the number of workers who are attached to or aligned with GP practices who can offer mental health support. So we're seeing an ever-growing range of mental health routes to get support and help with your mental health than perhaps the traditional route of a GP referral into a child and adolescent mental health service or a psychiatry service. And we're also seeing big expansions in the use and availability of things like computerised psychological therapies. And these will make it much more easy for people to access appropriate therapies if those are the right things for you. On resources, we've seen expansion in resources in mental health over the last few years. And while I'm not going to stand here and say we wouldn't welcome more resources coming to mental health services, we always would do. I think it's important to think also about how we use those resources, and just increasing the capacity of specialist services doesn't resolve the problem. What we need to do is to expand the sorts of services that are available to people around community mental health and well-being, so that more people can access help more quickly, and that fewer reach the point where they require the need for specialist mental health services. We will always need those specialist mental health services, and they always need to be well-resourced and of good quality, but we also need to expand the other options that are available to people.
Neil Pooran from PA.
Thanks, First Minister. One for Dr. Cook on mental health, as well as the impact of the pandemic itself. Over the longer term, we're going to see people facing more economic uncertainty about their jobs, about their incomes, probably for quite some time. So what kind of impact will that have on mental health? What kind of groups will that affect? And one for Dr. Steedman as well. In terms of the 12-week gap between the doses of the vaccine, are we measuring what the impact of that is going to be on transmissibility? In that, will there be some people who get it in the original time frame versus other people who have it over that 12-week period, to see what the varying impacts are going to be on their immunity?
Okay, Dr. Cook and then Dr. Steedman.
Thank you. we know that periods of economic downturn and the impact of people having loss of job and just economic uncertainty has a negative impact on the mental health of the population. And we will undoubtedly see some impact on that in the longer term as we come out of this current crisis. The Scottish Government published what we call the Transition and Recovery Plan for Mental Health in October of last year. And the Transition and Recovery Plan is really looking at how we rebuild mental health services and wellbeing community services coming out of this period, beginning to look very much at disadvantaged groups. We know that there's been a particular impact on young people, and we know that the restrictions that we've faced over the last year have had quite an impact on people who already have mental health problems. So there is concern about the degree to which already existing inequalities are being emphasised or exaggerated by the current situation. So the Transition Recovery Plan very much takes a view on how we do that across the whole range of the mental health system. And we're also doing a piece of focused work just now with health boards and community and health and social care partnerships in looking at the renewal of the secondary care mental health services within those.
So thanks very much. Regards the 12-week interval between the first dose and the second dose of the vaccines, then yes, we are monitoring that. Just to remind people that this is something that the MHRA and the JCVI, the Joint Committee on Vaccination and Immunisation, have both agreed with the approach that we're taking with this. So we would, however, still wish to monitor vaccine effectiveness in the real world anyway. So that is part of the plan, and that's something that we're doing. But the evidence from all other vaccines and the evidence that we certainly have from the clinical trials in the AstraZeneca vaccine are that there is no reason to think that the amount of protection, which is high, that comes after that first dose will drop to any significant extent within that 12-week period. And just to back that up, as well as us actually doing that surveillance and monitoring, you'll perhaps know that there's a study that's been pre-published today, a really important study called Siren, which looks at healthcare workers who either have had COVID already or have not had COVID already, and then follows them up for, it's 5 months so far, but it's still ongoing. And what that's shown is that there's an 83% reduction in the chance of getting COVID again if you've had COVID before. So in other words, COVID provides a degree of ongoing immunity to stop you getting it again, at least out to 5 months. So you can imagine then if our vaccines are trying to mimic that immunity, then we would hope and expect that that first dose would protect people really for a number of months, which is again some contributory evidence as to why this is the right thing to do, to extend that interval to 12 weeks so we can give first doses to as many people as possible and give them that high first dose protection, again, to as many of our vulnerable people as quickly as we can.
Right, Scott McNabb from the Scotsman.
Thank you, First Minister. Going on to business, the Scottish Hospitality Group today are estimating that firms have taken on debts of up to £1 billion as a result of the crisis. But they're asking for more honesty from politicians, Westminster and Holyrood, about funding available, and also for it to be getting into the hands of frontline businesses much more quickly. Are you satisfied that this money is getting to businesses as fast as it can be? Thank you.
No, we're trying to get it to businesses faster and as fast as possible, and the Finance Secretary, Kate Forbes, is very focused on making sure that as we announce financial support, that any arrangements for getting that out the door are put in place as quickly as possible and it gets to businesses as fast as possible. And I think we can further improve that, to be frank about it. Hospitality has been harder hit than most other sectors in this pandemic, and that is something that all of us feel heart sorry about, and we want to look forward to a day, hopefully not too too much further in the future where we can start to support the recovery of these sectors and we start to make that journey back to normality, where we can look forward to going to pubs and restaurants and stay in hotels if we're able to again. But right now there's no alternative to this, and that's the hard thing. But the financial support is there. The Finance Secretary just in the last few days announced additional funding for the hospitality and retail sectors. So at the end of this month, January, they will get, in addition to the payments they would already have been expecting to get, top-ups, which are greater for bigger businesses and for smaller businesses, but recognising the impact, but also recognising that often for businesses in the hospitality sector, their busiest and most profitable time of the year is over the festive period, and they have lost that trading opportunity. So that's why the January top-up payment is available. So this is not easy for anybody, and I understand that, but so much of what we talk about right now comes back to the fundamental truth at the heart of all of this. We've got to suppress this virus, and that takes every single one of us to behave in the ways we all know helps to stem the spread, because that's the only thing that then, with vaccination doing its work, that will open the way for a return to normality and businesses to get back on their feet, as we all desperately want to see. Michael Blackley from the Mail.
Thank you, First Minister. This morning, the Deputy First Minister had suggested that if people don't follow the current rules, they might be tightened even further in addition to yesterday's changes. There are some notable differences still between this lockdown and the last one last spring, notably things like travel for leisure. The construction industry is still allowed to operate. Are these sort of areas things that might need to be changed in the future? And also, just on another issue, I wanted to check with you. Alex Salmond was asked to travel to the Scottish Parliament to give evidence next Tuesday on the Holyrood inquiry. His representative said that it wouldn't be appropriate to do that because it would send a very bad message to the country on travel. Do you agree with that conclusion, or do you think that the public interest in this case means that travel could still take place? Thank you.
Look, the arrangements for giving evidence before a committee are for Parliament. Parliament operates within the guidelines that everybody else operates within, although the nature of what Parliament does means that we do sit in person, albeit in reduced numbers. But on that issue, that's a matter between Mr Salmond and his representatives and the committee, and I'm sure they will discuss and come to an agreement or not around that, but I don't think it's something for me to say any more about. On the first part of your question, I mean, I'm not sure this is holding any front pages, but we are in a pandemic of a very infectious virus. And if we don't manage through the current restrictions that are in place to suppress it sufficiently, then yes, we will have to consider additional measures. But that's been true since day one of this, and it remains true now. What we set out yesterday is what we think will help at the moment. We do think that the restrictions, obviously yesterday's haven't come into effect yet, but the restrictions that have been in place now for both since Boxing Day and then the tightening of those at the start of last week, we think they are starting to have an effect, and we think we're starting to see a stabilisation in case numbers. You can see it in what I'm reporting to you every day, but it's too early to be sure that that is sustained. And of course, with this virus, we can't have just a stabilisation at a really high rate of transmission. We've got to force infection rates down. So these are things we keep under review all of the time. But you know, we set out, when we decide to do things differently, we set out that openly, and we set out why that is the case, and that won't change for the remainder of the time we're living through this. Paul Mallock from the Courier.
Good afternoon, First Minister. I was wondering if you could tell us what plans the Scottish Government have in place to use dentists and other allied health professionals who may have a reduced workload at the moment as frontline vaccinators to help get the vaccine rolled out as quickly as possible. And with that in mind, will the Scottish Government be providing any investment grants for dental practices to help install ventilation improvements in surgeries the way that the Welsh Government has to prevent any so-called two-tier dentistry system?
I'm not sure what you're referring to with the Welsh Government. Happy to look into that. I'm not even sure whether the funding arrangements around dentists are exactly the same in Scotland and Wales, but we'll look into that. We have provided funding for dentistry over the course of the pandemic because, of course, while they are operating more normally, now we're severely restricted at the outset. And yes, we want people who can be appropriately trained to administer the vaccine to do that as part of the overall programme. We have sufficient numbers of people doing the programme right now, but as we set out yesterday, that has to scale up as supplies scale up. We will see community pharmacies, for example, start to come on stream as vaccination sites over the next few weeks, but I don't know whether you want to add to that.
Very briefly. So yes, we're looking to scale up and involve many of our primary care contractors. So I mentioned that earlier. So dentists, optometrists and community pharmacists as appropriate and as they can be used to give vaccination. But I think I can't comment on the payment side of things, obviously, but as far as ventilation of areas goes, then we know that ventilation is really important in terms of preventing COVID, and particularly the sort of airborne tiny particles. However, I mean, anywhere that is offering healthcare or social care services at the moment, in whatever sense, should be looking towards their ventilation provision and should be doing that anyway. Dentists will still be seeing emergencies at the moment. I know they are, because I know people who've had to attend them. And we have to assume at the moment that, that anyone can be infectious. And so ventilation is a really important part of our COVID prevention armoury, and we shouldn't forget that. So it's really important, but that's not to do with vaccination, that's just to do with preventing transmission of COVID.
Christine Lavelle from The Sun.
Thank you, First Minister. A Freedom of Information response reported today has shown that amid the pandemic last year, senior Scottish Government officials spent hours, if not days, preparing for hearings of Holyrood's Alex Salmond inquiry. It also shows that £54,000 was spent on external assistance for officials, but doesn't say what that was. Can you tell us what that assistance was? Was it a PR firm or lawyers, for example? And how can you justify dedicating this time and money when people might expect senior civil servants to be focused on the pandemic?
No, I don't know what it was for. One of the things around the committee, and I'm not going to go further into this because this is a COVID briefing, is that those who are due to give evidence, which includes me, are not meant to talk to others that are given evidence. But I'm sure the government will answer any questions on that you've got. Do you have a COVID question you want to ask before I move on?
Well, I mean, it's like the point I made at the end of my question. People would expect senior officials to be focused on the pandemic. So I was asking you how you could justify spending this time and money.
I don't know the detail of it. For the reasons I've set out, I can't answer your question. The government, I think anybody watching us every day, watching the whole response, would draw the conclusion that this government is focused on the pandemic. As one of the questions, I think, from Jack Foster from Global indicated earlier on, though, obviously other things happen and other things have to get attention from government. That's been much of that has been drowned out by COVID. So, it's not the case that there will not be officials in government doing different things at different days as required. But I don't know the detail to give you the answer to the question for the reasons I've set out. But because I'm trying to be as helpful as possible on COVID, if you have a COVID specific question, I'm going to give you one last opportunity before I move on to the next journalist.
Okay, I'll take that opportunity. Just on schools, what are the factors that will determine the return of schools? Is it purely down to levels of community transmission? And if so, what are the thresholds you're thinking about? I know you've already said nurseries and primaries could reopen first, but could you see the return of schools in certain areas before others?
Again, I've answered this question before. We will try to get schools back as quickly as possible. I think it is... would not necessarily be helpful or accurate to talk about set thresholds. We need to get community transmission down. When we opened schools back in August, we made that point. Schools, and we did manage to keep schools open for the remainder of last year when they opened in August. But it depends on community transmission being sufficiently low. It's too high right now, so we need to get it down. And we've wanted to understand a bit more, which we don't fully yet, about this new variant and whether and there is no evidence that it does at the moment, but whether it has any particular issues in terms of transmission for young people. So these are things we will discuss and consider on an ongoing basis. We are due to review this, as I set out last week, mid-January, to determine whether or not we think schools will open at the start of February, and I'll set out our conclusions to that next week. And we will, of course, when I announced the regrettable closure of schools, I made the point then that as we try to get them open again as quickly as possible, it's not necessarily a binary thing, like all open or all closed. If it's deemed to be safe to get younger peoples back before older peoples, we will do that. If community transmission is much, much lower in a particular part of the country and we think we can open them there, we will do that. But we are not at the point where we can give those decisions right now. Simon Johnson from The Telegraph.
Good afternoon, First Minister. I just wanted to ask about the reasons for which the UK government had requested that the Scottish Government's vaccination plan be removed from the website. I think you mentioned in Tuesday's briefing a Four Nations call with Michael Gove, at which Mr Gove and I believe Jonathan Van Tam raised concerns that if too much detail was provided over the supply, that basically other countries would be able to see this, would be able to see how much the UK was getting, and may put pressure on the manufacturers to basically get a bit of the UK supply if they were getting less. I understand that UK ministers were very concerned about that when they saw the information that was published yesterday. And I wondered if you were concerned that what was put out yesterday will increase pressure on the manufacturers or they'll come under rather increased pressure from other countries now to give up some of the UK supply, given we can see how much the UK is going to get. It was a relatively simple calculation to work out from what you put out yesterday what the UK supply was. Thank you.
I am not convinced of that. This is supply. The UK government have been talking for a long time about the supplies that they have managed to secure. So, these are estimates of the supplies that have been secured. So I'm not convinced, but I think it would be for UK government ministers to talk more about the basis of their concern. I'm going to just reflect on a little irony here, that for the past week or so, I have periodically been getting asked why we don't publish figures on supply. And I've had journalists say to me, how do we know you're publishing daily figures on numbers vaccinated, but how do we know you're going as fast as you can if you don't tell us the supplies you have? So we're trying to be open and transparent about that. I think it is right to say to people, here's what we expect to have. Caveats have to be inserted in that because things can happen to disrupt the flow of supply. But here's what we expect. Here's therefore who we're trying and the numbers we're trying to vaccinate. That's what journalists have been calling on us to do. So that's what we sought to do. The UK government have raised a concern about the commercial confidentiality of some of the supply figures. So in the interest of being constructive and trying to work together, we have taken that down in order to have a discussion about what they would be comfortable about us publishing. But I think the more open we can be right now with people, there is massive concern and interest and anxiety about this vaccination programme going as quickly as possible. At the weekend, you talk about UK government sources. At the weekend, I was reading UK government sources criticising the Scottish Government for not going fast enough, saying, they've got more supply than they're letting on, so they could be going faster. What we've tried to do is just put it out there so that people can judge, and that's the right thing to do. But as a responsible government, if there are genuine concerns raised about that, we talk about that, and that's what we will do. But I'm going to try and be open and transparent about this.
Zahawi, after the publication last night of the report, phoned the chief executive of AstraZeneca seeking assurances about supply. I understand other UK ministers did the same with some of the other manufacturers. Do you think that was an overreaction?
I don't know whether that happened or not. So, I'm not going to comment on what other people do. I will stand here and be accountable for what I do. Tom Martin from the Daily Express.
Hi, thank you, First Minister. Could I just return to yesterday's changes, please? Some retail groups are raising concerns that there's going to be quite a short time scale in having to implement this, and just given they're yet to see the full regulations or guidance, are they getting adequate time? And secondly, just in terms of compliance around the current regulations, given today's snowy weather, inevitably we may see some older children over 12s wanting to head out to public spaces, parks, etc., with their friends for sledging and snowballing. What advice would you have to them and their families to keep safe and within current regulations?
Well, right now for older children, the rule on exercise is the same, outdoor exercise is the same as the one for adults. So if you are with somebody from another household, that should only be one other person. So there should only be two of you in a group. You can go out and exercise for that. And on a snowy day, sledging safely within those limits may well be, you know, the exercise that a younger person would want to have. But, you know, I hate standing here talking about limiting, you know, what kids can do on a snowy day. But this is the situation we're in right now. This is about trying as hard as we can to stop this virus spreading. And the more we do that now, then hopefully the sooner we get back to some degree of normality. And so by the time there's snow next winter, if there's snow next winter, nobody has to worry about staying within COVID rules. They can go and enjoy it. So I'm sorry to young people who are, more than anything, I'm sorry to everybody who's having to live under these restrictions right now. We're all, you know, feeling miserable about it. But I'm in particular sorry to young people. This is horrible. This should not be happening to you. You should not be away from the school and your friends. You should not be, you know, under restrictions when you want to take a sledge out on a day where there is snow. I am so heart sorry for what you're going through right now, but it will not last forever. And that's the thing. I know it's hard, but you've got to hold on to. And in the meantime, try to behave in a way that keeps yourself safe, because if you keep yourself safe, you're helping to keep the older people around you safe as well. So stick with it. I know it's really, really tough. And on the first point, which again, I sort of go from there to here, we have to strike a balance here. I'd love to have more time to consult. I'd love not to be doing these regulations, but given we have to do them, to take endless days to consult with people. But this virus doesn't kind of stand back and allow us to consult on regulations. It's out there, it's doing its damage, it is spreading. So we have to act quickly. And, you know, saying, I announced these changes yesterday, Wednesday, saying they'd come into effect on Saturday does give time for us to publish the regulations. But even that, you know, that's a couple of days where the virus will be spreading. So we can't extend that too much. And I know it's difficult for business, but that's the reality of the situation we're in. Nicola.
From a clinical point of view, we are always behind the virus. We've said this the whole way along. Every time we look at the figures that we're seeing, we're 2 weeks behind when these people got infected. You know, every day matters. And therefore, as the First Minister says, we have to try and be proportionate. And it's even more important now with the new UK variant, which we know is even more transmissible. Look at all the, you know, the restrictions we have in place at the moment and how slowly those case figures are coming down. We have to act as fast as it is possible to do when we know we need to put other things in place. Go fast, go hard, go early. That's what all the scientific experts are telling us. And even then, we're always behind the virus. It's just a question of how much.
Okay. Tom Gordon from the Herald. Is Tom Gordon there? Is he? Right, I'm going to move on to Kenny McBride from Broadcasting Scotland.
Thank you, First Minister. I know Alison Thulis has been pressing at Westminster for UK government support for the so-called excluded workers, but what will or what can the Scottish Government do to support some of those workers in Scotland? And has there been any movement from the Treasury on the £375 million they announced and then withdrew the other day?
On the latter point, not as far as I'm aware, unless something has happened in the very recent past there, and we will continue to press these issues. On the first part of your question, we have already designed many of our funding streams to take account of people that would otherwise have fallen through the gaps, and we continue to try to do that, as well as try to press the UK, as Alison has been doing, to do more for those who haven't had help so far. So that is something we will continue to try to do as much as we can on, and persuade the UK government to do more on too. Mark McLaughlin from The Times.
Good afternoon. This is one that could probably cross the whole panel because it covers the political and the psychological and also the medical. Since the 21st of December, according to National Records of Scotland, excess deaths from other causes not related to coronavirus have been rising quite sharply. There's been 641 COVID deaths and around about 300 other deaths not related to COVID, 200 of which are listed simply as other, 114 cancer, 47 heart and stroke. Now, we saw this phenomenon in the first wave. Over the piece, over last year, there was about 6,000 COVID deaths and about 1,000 excess deaths. It's about 6-1, but in the recent period, it's around 2-1. So are we now seeing the effects of mental illness over the Christmas period? That kind of idea. Are you concerned that by maybe raising hopes of Christmas mixing and then retracting them, you may have exacerbated that?
I think it's a really serious issue. I think your last point there would be a massive leap of logic, and I think we've got to be very careful about that. I'm going to ask Alistair and Nicola both to comment on this, and if I'm wrong, I think Nicola in particular might be able to illuminate you. But I don't think, while I think the general premise of the accumulated additional effects of COVID certainly being felt is a correct one, I think we probably have to be cautious about drawing any firm connections between that and the particular figures you are quoting from, which I think possibly take more time to properly understand. So the issues you've raised, I think, are right and legitimate. I just would be careful about joining the dots between the different things that you've raised there too firmly at this stage. But Alistair, do you want to say a bit about this mental health impact in that, and then Nicola might want to talk about the excess deaths in a bit more detail?
Yeah, in terms of the mental health impact, I mean, I think there's two angles to this, one of which is the impact that perhaps deterioration in mental health might have on people who have already existing or chronic conditions and their ability to look after themselves. And we don't have figures that tell us whether there has been an aspect of that. The other area, I suppose, would be, I do hear anecdotally people talking about a rise in suicides during this period. Again, it's too early for us to know what the figures of those are. Earlier in the pandemic, we've been monitoring this. It looked as though suicide rates, all suicides, having any suicide rate is a terrible thing, but it looked as though suicide rates were not particularly up or down on previous years, but we still need to wait for confirmation of those figures. So I think yes, there may be some impact, but no, we don't have any real evidence at the moment to support what that might or might not be.
So excess deaths is one of the things that we monitor very closely on a year-by-year basis anyway, but particularly in the time of a pandemic, because it's often where we see the greatest rises. And obviously we try to take it down into things that we think are COVID related and then the others, which are the ones that you're talking about. But the first thing to say is that there will be undiagnosed or unrecognised COVID related deaths within that population. That's one of the potential reasons for the increase in non-COVID excess deaths. There might be some unrecognised ones in there. There are obviously some other reasons which it could be, one of which you've alluded to, and that's the unintended consequences. So the non-COVID direct consequences of the pandemic and the social harms and the mental health harms that come from the non-viral bits and the things that we have to do to combat the virus. And of course, there are other possible reasons, which is people potentially not coming forward with symptoms to healthcare that they usually would do. And so that's one of the reasons that we have always been really, really clear that the NHS is still here for people. And if you have symptoms and you need to be seen, please do not hesitate. We have tried to preserve those services so hard so that you can attend if you need to. And we've also tried to keep, for example, you mentioned cancer. During this period of restrictions, we've been very clear that we want to try to keep screening programmes open, for example. exactly to try and prevent any unnecessary deaths from cancer. So we are in a programme of research with Public Health Scotland and with NRS on those excess deaths. It's very, very difficult when you get down, because those numbers might sound quite large at 300, but when you get down to individual conditions, the numbers are really small, and it's hard then to draw the kinds of inferences that you might be wanting us to. But rest assured that that work is ongoing. So it's really to say there's a number of issues. We know that the research is ongoing, and it's just that it's very, very difficult in terms of the numbers. There's some good articles published on excess deaths in JAMA and BMJ in October of last year, and lots of other countries around the world are seeing this too. There's a good report from the US showing an increase in excess deaths, funny enough, with some similarities to ours and some differences. So it's a problem we're all grappling with in the pandemic.
Thanks. Nicola, I'm told Tom Gordon might be online, so I will try again.
Yep. Hello there, First Minister.
Hi.
Hi there. A couple of quick questions. On the vaccine programme, Jean Freeman appeared to let slip the name of a confidential storage site in Parliament yesterday. Has she offered any apology for that to you or the supplier or to the UK government? And secondly, how do you think the credibility of these briefings is being affected by you personally being under investigation for allegedly misleading Parliament and the country on another matter?
On that, I don't, and I think all of the evidence would suggest that they're not. The Health Secretary answered a question in Parliament yesterday, and she gave information. We don't advertise that. It is, information that's available, but we don't advertise it. But she answered a question in Parliament. And sometimes, as I reflected to, I can't remember who it was before, often we are being told that we're not being transparent enough. And then when we give information, we're being criticised for giving information that other people say we shouldn't give. So we'll continue to try to get the balances right as we possibly can. That concludes the questions for today. So thank you all very much for joining us. Thanks to Rachel for the BSL interpretation. My thanks to Nicola for helping with the questions, and to Alistair for being here as well and setting out the help that is available for you should you need it. This is a really, really tough time for everybody, and many people will be struggling. So please, if you do need help, make sure you get it. My main and concluding message to you is please stay at home. We really need everybody to limit their interactions as much as possible so that we get on top of this virus and start to drive these infection rates down so that we can slow it up while the vaccine programme is speeding up and let it ultimately win the race, and the rest of us hopefully get back to a greater degree of normality. So please stay at home, protect the NHS, save lives. The briefing will be here tomorrow as usual at 12:15, but in the meantime, thanks for joining us today.